We will be beginning in about 2 minutes. 2 minutes.
An environmental.
We will begin in about 1 minute. 1 minute.
Good afternoon. I want to thank you all for joining us today at the Health Department for our weekly update on COVID-19. We have some members from the executive team that will be sharing or answering questions and sharing updates regarding COVID-19 over the past week. Sean, I'm going to turn it over to you and let you share updates from the past week.
All right. Can you hear me all right, Tracy?
Yes, I can.
All right. So I'll give just basic case count information. I'm looking on our board, so you'll see a side view for a moment. We've had 101 total cases in Adair, 19 deaths, 78 recovered, 4 currently active cases, 3 of those in home isolation, 1 in the hospital. 8 total cases in Casey, 4 of those are recovered, leaving 4 presently active, and those 4 are on home isolation. We have 5 total cases in Clinton, so far all recovered, so no active cases in Clinton. In Cumberland, 5 total cases, 5 recovered, no active cases in Cumberland. In Greene County, we've had 2 total cases, 1 recovered, leaving 1 active, and they're in the hospital. We have 13 total cases in Macquarie County. All 13 have recovered, so no active cases in Macquarie. 66 total cases in Pulaski, 2 of those deceased. 59 have recovered, leaving 5 active cases at present, all 5 on home isolation. We've had 36 cases in Russell. 4 of those have deceased. 20 have recovered, leaving 12 active cases, and all 12 are on home isolation. 15 total cases in Taylor. 1 of those passed away. 12 have recovered. 2 remain active, and both of those are on home isolation. We've had 9 total cases in Wayne. All 9 have recovered, and also no active cases. So that's a total of 260 total cumulative cases in our district. We have 26 deaths. For a 10% mortality rate, 206 recovered, and we have at least 28 active cases, 26 on home isolation, 2 are in the hospital. At this time last week, we had, since the beginning of the week, since Sunday through the end of business on Wednesday, we had added 15 cases, new cases. And by the end of the week, by the close of our numbers on Saturday, we had added 8 more for a total of 23 cases last week, which other than specific location events like a church or a nursing home. That was our worst week since this began. So far this week, we're outpacing what we did last week. So far, we are at 16 positive cases through or 16 new cases this week. That's including what we've had up until this morning and the 5 cases that we've added today. So 16 so far up until this moment, new cases this week, and we may get more before the day's out. And of course, we don't know what we will receive the rest of the week to see if this turns out to be a more aggressive week for the spread of COVID-19 than this week. We are seeing on the world stage, and on the national stage, at the state level and at the local level, cases are on the rise. Why do I think this is happening? I've certainly, this is not a scientific study, but seems like a lot of the people I've spoken to over the last few days were totally unaware that last week was the worst week in Kentucky since this started, as far as the total new cases and the total active cases. This was Kentucky's worst week. And no one that I spoke to out in the community knew that. So, my feeling is people have been inundated with COVID-19 information for so long that they're, kind of become complacent with it. They're checked out. They're disregarding it, and the cases are creeping back up on us, which of course we thought they would when people started getting out and moving around again. But we don't want it to get out of hand. A few things that I saw this week on social media that I thought I would address this week. There were some people saying that they felt like all of our new cases was because of the increased testing capacity. I can't speak for everywhere else, but I can speak for our district. And these drive-through testing sites and things that we've been having, the amount of positive cases coming out of those testing sites has been extremely, extremely small. In no way does the positives coming out of those drive-through mass testing sites account for the increase. So that's a false story or false assumption or false news or however you want to look at it. Testing alone does not account for all of the new cases. Now that means it's being spread in the community and people are getting sick, going and getting tested and finding out they're positive. I saw one person, at least maybe several, on social media that accused us of fear mongering. And you know what? That's one thing that I hope whoever said that is right about. I hope 2 or 3 months from now or a year from now we can look back and say, man, at this particular point in time, we really were overblowing this. That's something I hope happens, but my best guess is we're in for some very difficult days ahead. I think well, segue into my next point. Someone had put a message that they wish we could say some more hopeful things. And there are some hopeful things that, we have seen COVID-19 contained in nursing homes. We've seen it contained and mitigated in factories where they've had positive cases and it didn't spread throughout the whole facility. So, if you can use the guidance and the precautions to mitigate an outbreak in those extremely difficult circumstances, you can certainly control it and mitigate it in the public. That is, if the public will be an asset instead of a liability. And how can the public be an asset? Well, avoid crowds, try to stay 6 feet away from people, wear a mask, wash your hands regularly, don't touch your face, stay home if you're sick, meaning if you have a fever or if you're coughing. So, the public can be our biggest asset and the public can be our biggest liability. My guess is that there's going to have to be a second spike, and that second spike will be larger than the first spike, and it will take some places getting in a very desperate situation before the general public starts really paying attention again and realizing that this is far from over and we've still got some tough days ahead. And you know, when it gets to that point, perhaps they will, you know, start heeding the public message, the public health message about social distancing and wearing your mask and avoiding crowds and so forth, because that's really what we need to do to mitigate this. So, Tracy, before I turn it back over to you, I see we've got 53 people watching live, and you're welcome to put a question in the chat box. And if it's something that that we can answer, we will try to do that. So, Tracy, I'll turn it back over to you.
Thank you, Sean. And as Sean said, please do type some questions in the chat box and we will answer those. We have members of executive staff team that's going to be answering the questions received thus far this week. Stuart Spielman, our environmental health director, Dr. Wayman, our medical director, and Laura Woodrum are here today. So the first question is, what was so wrong in Signature Health Centers that caused Adair County's numbers to soar above all other like populations, and has investigations answered that question yet?
I took the first stab at answering this question, and if Dr. Wayman wants to add anything, or Stuart, from either a medical or a environmental perspective, you're welcome to jump in. Now, this is what I wrote when I was thinking about this question. It says, I wrote, Summit Manor was one of several long-term care facilities across the state that had an early outbreak of COVID-19. It seemed like there was 3 or 4 facilities right there just within a few days of each other that had a major outbreak. By the time the outbreak was discovered, it was so deep within the facility that it was very difficult to contain. Unfortunately, the public health priority at that particular moment in time was to attempt to slow the general spread of COVID-19 as to not overwhelm our hospitals' bed capacity and ventilator capacity. After that initial wave of outbreaks in the long-term care facilities, the entire public health response shifted or adjusted to start taking into account the tremendous threat that was posed by long-term care facilities, jails, prisons, any place where you've got these enclosed settings where a lot of people are. By no means was Summit Manor the only such facility that was impacted, and I've provided a link where you can go and read about all the long-term care facilities across the state who've had COVID-19 outbreaks and how they've turned out. That link is on the Kentucky COVID-19 website. You can just scroll down and there's one of the buttons or one of the banners says long-term care update, and you can click that and read about that. Dr. Wayman or Stuart, do you have anything to add from a medical or environmental perspective?
I would just say that over in Summit Manor's case, like Sean said, that by the time that we saw that happening there, that it was deep rooted in the facility. But we have had other facilities that once we were able to see a case there that came about later on, and we knew some of the things that we could do to stop an outbreak. We've been extremely successful with stopping outbreaks in other long-term care facilities. Unfortunately, you know, we learned some of these things after some of the other healthcare facilities, long-term care facilities in the state had already been deeply affected.
Thank you, Stuart. I see in the chat there's a question from Judge Jimmy Green. Any updates on fireworks shows, small carnivals? Thank you, Judge Green. I'll point that to you, Stuart.
Judge, we don't have any updates on that yet. I suspect that we will be seeing something on the fireworks soon and also the carnivals. If you've read or kept up with the governor's briefing, I think Kentucky Kingdom has a plan. They have a plan that they're working for the state fair. Of course, that's in August, but knowing that, I think we'll get some guidance on these small carnivals. And then on 4th of July, of course, if a community has fireworks on 4th of July, right now, people, if they were able to come and watch them from their car, that would be fine. we know our gathering of 50 is going to come into play on the 29th of June. So I really do look for some guidance on 4th of July activities as we get a little bit closer into the holiday.
And just as a general rule, you know, during a pandemic where you have a disease that's spreading through the community, you know, you want to do things to reduce your risk. The more you avoid crowds, the better. The more, if you have to be out, that you keep the 6-foot distance, the better. The more you wear a mask to keep your particles from spraying out farther away from you, the better. You know, the more you stay home if you're coughing or sick, the better. I mean, you want to do things to reduce your risk. Anything that's encouraging large gatherings increases risk. I know I read a lot of comments on social media this week about, well, you know, we've got all these protest gatherings happening, and again, I don't want to get into the political or the social aspects of the social justice cause. Everybody's got strong emotions about all of that. I can just say from an entirely public health perspective, anything that's encouraging crowds is not a good idea right now, regardless of the cause. When a disease is spreading, it's not good. It's not good timing. I guess that's enough to say about that. Judge Calwin said, I'm getting several questions on yard sales. I know you all changed your recommendations after the governor did. Any changes on that in the last couple of days? I'll let Stuart answer, but I will say, you know, there's several different departments at the state level who are working on guidance. There's a lot of coordination that has to happen there. And sometimes, you know, some guidance will come out to us from one department, and in a day or two, a different department might give a little different guidance, and you know, the governor's team has to sort out which guidance we're going to go by. When we released the information that yard sales were okay, it was because someone had guided us in that direction. However, when we heard the governor's daily brief, and he said, no, not right now, you know, we changed to align with the governor's recommendation. And, you know, that kind of thing's going to happen. I wish it was always really cut and dry and clear, but sometimes there are some confusions. So we always apologize when that happens. Do you want to speak specifically about the yard sales?
Yes, and actually the next question, I think I can answer these two, Judge Callan's question and question number 2. Tracy, if you want to go ahead and read that question, I'll try and answer the judge's question and our next media question all in one answer.
Okay, Stuart, here you go. While yard sales are not permitted at this time, a number of them were spotted in Macquarie County this past weekend. Are citizens who see such activities advised to report that? And will there be any level of enforcement by the health district?
Okay, so let me start out just by talking about the yard sales in general and the level of enforcement that the health department can do. You know, we're a 10-county district. We cover thousands of miles and a lot of territory, and we have 10 environmentalists that work for us here. So it is really nearly impossible for us to regulate something such as yard sales in a 10-county district. Also, you know, along with our limited manpower, we know that we really have limited authority when it comes to yard sales and what's going on somebody's individual personal property. What we're asking people to do is we're just imploring people that they hold off on these events until the governor's office clears them to proceed. So the governor has set the order, and that order's law, and we have not, since last week when the governor came out and said he was not allowing yard sales at this time, we've not had any additional guidance on when he may allow that to happen. But we do know our greatest concern is, again, like we've stated, what we want to see people do is stay apart, stay at least 6 feet apart, wear your mask, wash your hands, sanitize, avoid touching your face. And if you're sick, please, by all means, stay at home. Don't be out in the community. So, we're just imploring people to do the right thing, to be educated, to be smart about getting out there and resuming all the activities that are open.
We're not saying don't go to work, don't go out shopping, don't live a life. We're not shut in right now, and it's not healthy in a lot of ways to be shut in. We're social creatures, but we're saying when you go out, use good judgment. Understand that this is a community spread disease that spreads faster than the flu, kills a whole lot more people than the flu. There's no treatment for it. There's no vaccine for it. It's a new disease to the human species, and we don't have any residual immunity from the previous season. It's new. So, just use good judgment. Do things to protect yourself. Avoid those crowds. Keep your distancing. Wear your mask. Wash, sanitize. Do those things.
Okay, next question. Explain the details of contact tracing and ramifications for people who have been contacted that they have been exposed.
Well, the purpose of doing contact tracing is to prevent the spread of coronavirus. The index case is asked about all close contacts, that is, people who've spent at least 10 to 20 minutes with them within 6 feet. The index case is isolated, either at home or in hospital if they're sick enough. The quarantine people who are the contacts are to stay home and monitor themselves for symptoms. They are quarantined for 14 days, which is the incubation period can be extended to 14 days, although most people will develop symptoms around 5 days.
Yeah, and when you say index case, with my limited medical training, I think of index case as the original case.
Sorry.
We're talking about whichever positive case that we're investigating. We're calling that is the index case.
Within that small cluster, so to speak.
All right. We have another question. This is from Donna Parrish. This may be our very own Donna Parrish. It says, is the health department enforcing local businesses employees to be wearing masks? That'll be a Stewart question.
So let me start out the answer by talking about every time there's a complaint, you have to remember, just the same as when we go out and inspect anything, we're looking at a point in time. So what goes on at that point in time may not be the same thing that always goes on or that's going on the next day. When you go into a business, you may see somebody who is not wearing their mask correctly or has the mask on, and that may not be the normal. We know that is something going on at that point in time. So we have to, one, consider that. Two, we're still, when we were shutting, when the governor was closing places, we were able to really get in there and do some enforcement on that and make sure people done that. Now, as things start to open back up, and we're trying to enforce masking, remember, we have to look at what's going on at that point of time. Just because you see someone who's not masking, I've had several complaints where we've went to a place, had a complaint, they weren't wearing their mask. I go and I see the employees are wearing their mask. So it becomes very difficult. So at this time, still, what we're trying to do is we do follow up with those complaints, but we are making sure that we're pushing our main message out there of education to these people. Please wear your mask. Please wash your hands, and please distance from each other. That is the main thing that we want to get across. And instead of beating somebody over the head with a stick, we'd rather educate these people and have them to understand why that you need to do these things.
Thank you, Stuart. And I might add, as I said earlier, our biggest asset in this challenge of COVID-19 is the public, and our biggest liability is the public. We've seen this COVID-19 be mitigated and contained in very difficult environments like nursing homes and factories. It can be contained in the general population if the general population will observe this guidance. So, that's the message we want to keep conveying. This can be contained, and we don't necessarily have to have a great large spike of cases, and no reason why we have to shut the economy back down. But it's going to take a commitment from the general public to observe those guidelines. Otherwise, the big tsunami of cases will come, and by the time we're all paying attention, it'll be so deeply ingrained in the population and spreading so freely, it can be too late to do a whole lot about it until it runs its course. So,
and let me add on mask. Remember, my mask protects you. Your mask protects me. If you think that you're too strong to get COVID-19 and you don't wear a mask, you may just be out hurting somebody else by doing that. If you're an asymptomatic carrier, you're just hurting somebody else who is wearing a mask. So please take into account your fellow man out there and wear the mask when you're in public.
Thank you all. Next question, is the number of positive cases in Russell County because of the testing event that took place a week ago, or is it because so many people are now not taking precautions? And I think you referenced that just a few minutes ago, Sean.
Yeah, and I took the first stab at answering this question. Again, Dr. Wayman and Stewart are welcome to add their insights. I put testing, of course, reveals more cases than not testing. However, COVID-19 is on the rise at the world, national, and state and local levels. So expanding testing alone in no way accounts for the expanded number of new cases. And in fact, I can tell you in our district, the mass testing has revealed very, very, very few new cases. The new cases are when people are feeling sick and they go and get tested, and it's not happening through the mass drive-through sites. Of course, we hope that if people have it and they go to these mass sites, that it's revealed and we can intervene earlier. But that's just not been our experience, that the testing is what's causing the rise in cases. Therefore, without a doubt, the spread of COVID-19 is increasing because there is a complacency with complying with the public health recommendations of avoiding social distance, avoid social gatherings, maintaining social distancing, wearing masks, washing one's hands regularly and thoroughly, avoiding touching your face, and staying home if you're sick with a fever or coughing. So that would be the main reason for the spread as far as I'm concerned. Dr. Wayman, Stewart?
I agree wholeheartedly.
So, Tracy, did you have any more questions?
That's all the questions I have, Sean.
All right, we have 68 people watching live, and YouTube Live is about 15 seconds behind us. So I'm gonna stall for a second to see if anyone wants to ask another question. And I would just return to the message that we implore that the public follows the guidance that we've been restating over and over since this began. And I would really hope that we can take things serious before the cases rise to the level that it'll be difficult to get our hands around it. Jimmy Green says, I think all of you at LCD HD are doing a great job, and we appreciate it. Well, thank you, Judge Green. We appreciate what you all are doing down there in Macquarie County too. That's all of the comments I see. So, Tracy, I'll turn it over to you to wrap us up.
Hey, I just want to say thank you all for joining today. Remember the precautions to help reduce the spread of COVID-19 out there. We will be back next Wednesday, 2:00. If you have questions, send them out to us and we'd be glad to answer them next week. Thank you all. Have a good day.
Have a good week. Be safe. Oh, I saw one more question here. Thanks again for helping us keeping the public informed. Well, you're certainly welcome. I agree with Judge Green. Thanks. That was Judge Cowan. Thank you, Judge Cowan. And I will see everyone